So blood pressure, this is the most awkward piece of equipment ever designed for man. There are a few things that will make this incredibly simpler if you listen up front. The first one is make sure the valve is closed before you try to inflate the cuff. I know this sounds very basic, but righty-tighty, that closes the valve, and that's what you want when you're pumping it up. And as you let it down, you're going to position your hand this way. It gives you a lot of control over that valve, so you let it down at just the right rate. The cuff itself, you want to make sure is the proper size. You'll notice there's this register index line over here and then this range on this side. And you want to make sure that the index line falls within that range, or you need another size cuff. And this is an important source of error in taking blood pressure. The other thing is, where does the cuff go on the arm? Here it says arteria, which means this goes over the brachial artery. And the patient position is very important. So I'm going to ask the patient to place the arm out. The tubes go on the inside of the arm, which is the first stumbling block. You want it to be up higher so you'll have space. You don't want any cloth or other clothing because that will increase the amount of force necessary to compress that artery. And then you wrap the Velcro with this side, and then you wrap with the other hand from the other, and it'll be nice and tight. You don't want to tie it like a tourniquet because that obviously adds to the pressure that you're going to get on the reading. When we look at the dial, let's make sure that the meter is calibrated. And you can see how if I don't undo that, or if there's air left in the cuff, you actually get a reading there. But this is well calibrated because the needle is in the middle of that white rectangle. And on your handheld units, you'll see the same thing. Each line is 2 millimeters of mercury. And that's how you take a reading. When you take a reading by hand, you should report it in 2 millimeter increments. If you really think you're a hot shot and report it out with odd numbers, people are going to become suspect. With the stethoscope, most people prefer to use the diaphragm side of the stethoscope, and it actually is somewhat counterintuitive because the bell is better for low-pitched sounds, but studies have shown that you can use either side of the stethoscope to do this. So the way this is going to look in terms of performing the blood pressure, first thing is to put the stethoscope in your ear so you're ready to go. We're going to check an approximation. So I'm going to put this righty-tighty and close the valve while watching. And it helps to hyperextend that arm like this. And in a minute, I'll show you how I'm going to hold it. Notice this is at heart level because that's going to make the reading more accurate. You'll also notice that the patient has his back supported, not really, that he didn't just smoke, isn't talking, you're not talking, both feet are on the floor, etc. There are a number of steps that you take to get an accurate blood pressure measurement. But to get in the ballpark so I don't cause him undue distress, I'm going to feel for that brachial pulse, or if you can't get a brachial, you can also feel a radial, and feel when that goes away. So I have a good, strong radial pulse, and at some point, it's like, okay, that's gone, and then it comes back at about 130. So that's an approximation. The reason for this is if you don't check for the obliteration of the pulse, you can severely underestimate the blood pressure. You have to get a tourniquet effect out of the blood pressure cuff, which means the pulse is obliterated. So, as stated, I got 130. And so now I'm going to do this for real with the stethoscope. And you'll notice I'm over the medial portion. It's not, again, not in the middle of the arm, but rather medial. This is wrong. This is correct, right over that artery. And so I've closed the bulb again. I'm going to pump this up, try to do it fairly quickly. And I'll go 30 above where I got the first reading. And I'm listening closely. And I get 108 over 78, which is a beautiful blood pressure. And then you remove the cuff. That's the right arm. When I come to the other side, I'm going to do a bad demonstration here. So if I just pull up his arm like this and put the cuff on, it's socially awkward. And so what I would prefer that you do is to hold the arm out to the side. This is for a right-handed examiner like I am. And once again, you're going to set up the cuff the same way, except that the tubing is on the outside on this side. No cloth underneath. You wrap these fingers around and then wrap back with the other hand. And that arteria sign is right over the brachial artery where I'm going to be listening. This takes lots of practice.